Mondays, Wednesdays, and Fridays on Eagle Country 106.3. It's Pet Tips with Dr. Joel Saylor of Town and Country Veterinary Clinic in Stark. And this week we're going to be talking about Lyme disease. Good morning, Doctor.
Good morning. Yeah, we're going to talk about Lyme disease. And Lyme disease is a tick-borne illness that basically we share with pets because not only do people get Lyme disease, animals get Lyme disease, and they will get it from tick bites just like we do. The name Lyme comes from Lyme County, Connecticut, which is where it originally started.
No kidding.
So this is a bigger problem up north.
Do they spell it L-I-M-E or L-Y-N-E?
L-Y-M-E.
Wow.
Lyme. And basically it's the tick-borne, it's a tick-borne illness, and everybody says, well, it's spread by the deer tick, and well, I got bit by a tick, but it wasn't one of the deer ticks. But Lyme disease can survive and be trafficked through any of the ticks that we see in Florida.
Wow.
And we see 4 common ticks in Florida. So just because it doesn't, because it's a Lone Star tick or it's a deer tick, don't think, okay, well, I don't have to worry about this disease. A tick, anytime you have a tick, you need to get off ASAP because contact time is critical to the spreading of these diseases. Now, Lyme disease causes a lot of vague symptoms, which makes it very difficult in humans and in dogs to diagnose. And part of the reason is that depending on where the organism ends up, that's where your symptoms are going to be. So there might be joint pain. So one of the things we see is called shifting leg lameness, where the dog is limping on one leg and then it goes away and then it's limping on another leg. We also add this other symptom called fever of unknown origin, low-grade fever. Now, this is a common misconception because, and it oftentimes goes misdiagnosed in people and in dogs, is that, if you say, well, you're not running a fever, so you can't have Lyme disease. That is absolutely false. Absolutely false. You do not have to have a fever, and you can very easily be incubating Lyme disease, okay? So, again, testing is critical, okay? And, again, a positive means you do have it. A negative doesn't always rule it out either because, again, the way this organism is trafficked in the body, sometimes it's very difficult to bring it up and catch it. It is treatable. It's easier to treat when it's early in the stage, so it's better to jump right on these things. Now, one of the key features, but if you don't see this, it doesn't mean you don't have it, okay? Again, is a radiating rash that extends from the bite. So it creates these kind of characteristic bullseyes. And it's called erythema migrans, and that is what that is called. So if you get a tick bite and you get like a little red rash that spreads out away from the tick bite, you absolutely, without a doubt, need to go in and be checked. As a matter of fact, in my opinion, if you've got that radiating lesion, you don't need to be checked, you need to be treated. Okay. Yeah. Same thing for dogs. And so be on the lookout. Also, too, on that note, if you are having symptoms that personally, and we do this with dogs as well, that might be consistent with a tick-borne illness, don't stop at Lyme disease. There are other tick-borne illnesses in the state of Florida. Rocky Mountain spotted fever. There's a current study underway right now at the University of Florida that's looking at the Lone Star tick population in this area, and they have found that about 50% of those Lone Star ticks carry the organism for Rocky Mountain spotted fever, okay? So if you only test for Lyme disease, you're not going to pick up Rocky Mountain spotted fever. There's also anaplasma, there's other ones. So again, if you're showing symptoms, both with your dog or yourself, don't let your physician or veterinarian stop at just checking Lyme. Have them check for the other tick-borne illnesses that are around. So that's my little tip both for dogs and people today.
That's right. We don't normally get the human side of things, but it can affect both and has. And we'll be back right after this message.